1.5 crore people in the country suffer from a mental illness called schizophrenia. And unlike depression and anxiety, schizophrenia and psychosis is more serious because it's a great economic burden to this country. May 24th is commemorated as the World Schizophrenia Day, and today we have an expert with us who will be actually taking us through the nuances of schizophrenia. I'm Ganeshan, I'm the Vice President of Synapse. I take this opportunity to welcome Dr. Harsha. Dr. Harsha is a highly qualified psychiatrist. He is equipped with an MD from JSS Medical College and is currently the head of the Department of Psychiatry in the Ambedkar Medical College. Welcome Dr. Harsha to this particular program.
Thank you.
Where the objective is to give the commoner an idea on what is schizophrenia. So my first question to you is, what is this schizophrenia and what is split personality and how do you differentiate it and how would you like the people to understand this disease?
Well, at the outset, schizophrenia is one of the most severe, or I should say deadly psychiatric disorder that we usually handle. The worldwide prevalence of schizophrenia is around 1%. So it is 1%. If it is getting so much of attention and there is so much of research happening, you should be able to understand and imagine how severe this disease is. For you to make it easy for you to understand, there are two types of diseases that we handle. One is called neurotic, the other one is called psychotic. When we say psychotic, there the patient will not have insight towards the kind of problem that they have. They would have quite severe symptoms like delusions, hallucinations, catatonia, and lot many other psychotic symptoms. So which is enough to make their illness quite severe and probably cause a lot of socio-occupational disruption. So schizophrenia is the very serious form of psychotic illness that we deal, and it is quite different from the split personality what we usually understand. Split personality falls on the neurotic spectrum of the disease, the dissociative disorder or the conversion disorders what we call, but schizophrenia is quite severe psychotic illness which will usually have a lot of debilitating consequences and may cause a lot of disability adjusted life years to the patient, okay? Not just for the patient and also for the family. So it is a neurodevelopmental disorder what we say. It is something which the changes start happening right from birth. It is quite genetic also in origin.
Right, sir. So that comes to our next question. So what would be the early warning signs of schizophrenia? Like how would of course the patient himself would not be able to recognize the disease, but the attenders around him would have to recognize the disease and bring the patient to an expert like you. So what are the things that these common people around him, what do they need to actually look into?
So to understand this question, probably we'll have to understand when exactly this disease can happen. Though I told you that it is a neurodevelopmental disorder and the changes happen right from the beginning, as in right from birth, but still the presentation is quite different. Okay. There are schizophrenia has what we call as bimodal onset. It can happen around the age of 17 to 25 and again around the age of 40 to 45 and very rarely in elderly. So 17 to 25 is what we actually look for, the individuals. Okay, someone who have just finished their plus 10th standard, the age group where we actually look forward for. There is something called as prodrome in schizophrenia. Prodrome will happen for a year and a half, wherein you actually observe certain changes in those individuals, which we probably, as a specialist or a psychiatrist, you understand that there is something evolving, something big is coming. So there will be sudden drop in their performance. Usually most of these students are, they would be very good in their academics, and all of a sudden you see the drop where they would not be able to perform at school, and they also, evolve developing some kind of suspiciousness. They would develop a lot of odd behaviors. They would stop talking to people. They would not interact with their peers. Okay. They would be quite aloof, restrict to themselves. These are some warning signs. They would not be able to sleep. Okay. Everything becomes a little odd and eccentric. And these are some signs, I should say, something what you should be looking in a very highly performing individual when there is a sudden drop. That is when you will have to think of this illness.
So, one of the most important questions asked by many people about schizophrenia is, what is the causes of schizophrenia? Is it genetic trauma, stress, or drug abuse?
When we look into the etiology of the schizophrenia, as in what exactly causes schizophrenia, 99% of the cases it is mostly genetic. It is something which is inherited from our parents. It is something which starts right from the beginning. A little or some number of cases where we call it drug-induced schizophrenia, mostly with cannabis or certain other substances, which can also put the patient on the risk of developing schizophrenia. So the tagline is, it is mostly genetic. It is nothing that you can do to avoid it. Okay. If you are at risk, it is important that it is identified as early as possible and use all the avenues for treatment.
Right. Sir, there is a lot of stigma and fear among people on a person's quality of life and their future. So people with schizophrenia can lead a normal life and can become successful in life. Is it possible with schizophrenia?
Of course it is. And we categorize schizophrenia into different types. The most common type what we usually find, or probably what we usually try to treat with a lot of confidence, is what we call paranoid schizophrenia, which actually has really good prognosis when being treated. And catatonic schizophrenia as well. There are certain types of schizophrenia which is usually very rare, the simple schizophrenia, what we call, or the disorganized or the habitual schizophrenia, where the treatment, even despite providing all best possible treatments, the prognosis might not be at the best. But something that should be kept in mind is what we call as duration of untreated psychosis. So that is something what every layman should understand. When it comes to schizophrenia, it is important that we treat this illness as early as possible. Right. The duration of untreated psychosis plays a huge role in prognosis of the schizophrenia. Right. But if it is identified and treated earlier, it should definitely have a better or good prognosis also. And some of the paranoid schizophrenias even disappear.
Right. Thank you, sir. Thank you so much.
Good morning, everyone. My name is Neil Clement, Senior Product Manager of Psychiatry in PMP. And there's one important question that our viewers would like to know, Doctor, is that what kind of support that family members can give for their patients?
Not just with schizophrenia, probably this question should extend to all other psychiatric disorders as well. There's something called as expressed emotions, which we usually try to measure using certain scales. Mm-hmm. Okay. In expressed emotions, there are certain way how you look after the patients, okay, in a positive way, in a negative way. It should not be too much of taking care of them, and it should not be too much of neglect or causing any kind of abuse also to the patient.
So basically a balance.
Basically a balance. We call it positive regard. Mm-hmm. So it is very important that the family of the patients with schizophrenia understand what this illness takes to be, and it is not that the patient is faking any kind of symptoms here. It is something what he or she is going through, and they are in unavoidable circumstances. It needs to be treated well. It needs to be followed up. Usually after 6 or 8 years after treatment of schizophrenia with whatever possible medications, they are again prone to develop what we call as negative symptoms. Not that the patient will not want to get better. The patient will have this set of negative symptoms where they will lose their capability to be normal. They will not have any kind of motivation. So they would reach that stage also. Okay. There are ways of treating it, both pharmacological and psychological ways of treating those negative symptoms as well. But through all this journey, it is important that the family is a very strong support. They understand what the patient is going through and see everything with a positive regard. They don't need to be over cared about. They don't, they can't tolerate that neglect or hostility also. It is very important that they see every patient or that family member who is affected with a lot of positive regard and warmth. So that will add to the progress research.
Thank you very much for your time, Doctor.
So I take this opportunity to thank you on behalf of Micro Labs for having enlightened us on the subject of schizophrenia. We are very sure these insights will be of immense value to the patients and general public as such, and that they will be able to approach professional as quickly as they can, so that the burden of schizophrenia can be reduced, not only in terms of the disease per se the patient is suffering, but also the economics on the whole. So thanks a lot, Dr. Harsha, for having spared your very valuable time today and having come out and discussed on this subject. Thanks a lot.
Thank you, Ganeshan sir. I think the whole idea of World Schizophrenia Day is improving awareness. Okay, so there has been a lot of research that is happening, around schizophrenia. It is we've still not reached a lot of people, and it is important that everyone knows, understands what this disease is and what it takes to get the patient out of this illness. And I appreciate the efforts that Micro Labs have been trying to put, on this special day to improve awareness about this illness. Thank you.
Thank you, sir. Thanks a lot.